Welcome to Ask the Experts South Texas. Each week, we'll feature experts to educate you in all things health and wellness. Call in and be a part of the conversation. 308-8867. 308-8867. 308-8867. And now the hosts of Ask the Experts South Texas, Dr. Nicole Davis and Dr. Don Bledsoe.
Good morning, South Texas. Thank you for joining our show today. This is Dr. Davis.
And I'm Dr. Bledsoe.
And we are Ask the Experts of South Texas, right?
We are.
And by day, we are doctors of audiology. We help the young and old hear better. Sometimes they don't want to hear, but it's actually healthy to be able to hear your loved ones.
It helps the brain function. It helps everything.
Yep. It saves marriages.
Right.
But Dr. Bledsoe, you just went on a medical mission to Guatemala.
I did. I spent a week in Guatemala.
And you tested little kiddos.
I did. I tested kids. I tested a few adults, but mostly kids, about 700 people.
That is a lot. So
it's a lot of people.
For people that are tuning in, that's a lot.
It's a lot. It's a lot of fun, though. They're super cute, super sweet.
How many had hearing loss of the 700?
Oh, I would say probably 10 to 15. Not very many. I mean, it's a high number, but it's not bad.
That's pretty good.
Yeah.
Considering.
Yeah.
Yeah. So were some of them due to fluid and infection, or were some of them true hearing loss?
No, it's true hearing loss.
So how do you treat that?
With hearing aids, of course.
That's what we do by day.
It's our day job.
So who donates those hearing aids?
The manufacturers.
Mm-hmm.
They donate hearing aids. So I just write letters and petition for donated hearing aids, and they send them to me, and then we take them to Guatemala.
And what's the average age that you find them? So say they've lived for a while with the hearing loss, and you see them and test them. I
would say between 7 and 15.
Yeah.
Years of age, yeah.
What's the severity of the hearing loss that you saw?
Anything from mild 40 decibels up to 75 decibels. There's some pretty significant hearing loss.
So even with like a mild, moderate hearing loss, you're missing about 40% of speech cues.
You are.
So think about if you were to plug your ears up with some cotton.
Or your fingers.
Or your fingers, and walk around like that all day. How easy that would be to learn. To be able to succeed in school.
Yeah, I've had a few. I had one little girl last trip I went. She lived with her parents and her grandparents, and her grandmother spoke mostly a mixture of Mayan and Spanish, and she could never understand what her grandmother was saying.
Oh.
And put hearing aids on. Her grandmother came with her to the appointment, and her put hearing aids on her, and her grandmother started talking to her. She's like, "Grandma, I can finally understand you."
That's a beautiful moment.
Yes, it was very sweet. She was very excited.
Oh, so I love the fact that you do this, because I do think it takes a lot of heart, and you probably have a bigger heart than me. I will say it right now.
No,
but you do it about
so.
Twice a year, and you are changing the lives of those kids down there. So thank you for doing that.
Oh, well.
Didn't you get sick, though?
I did get sick. Yes, I did.
What happened?
In 4 trips, I got sick once. This last time, I don't know what happened.
But you need to have an antibiotic handy.
I did. Took some Cipro.
Deficiency.
No, this was Cipro for sure.
And you're feeling better in a day? 2?
No, about 2. Yeah.
Right as rain?
Yeah, pretty much. Yeah, 2 days. Well, I took 3 days of antibiotics, but at day 2, I was feeling almost normal. So, yeah.
Well, I'm glad you're back and safe.
Yes.
And I'm very happy that you contributed and helped change the lives of these young kids.
Thank you. They're super sweet kids.
Yep. So if anyone wants their hearing tested from us.
Call us at 210-334-0245 or find us online at associatesofaudiology.com.
Yes. And then we have 5 locations, 3 in San Antonio, 1 in Bernie, and 1 in Kerrville.
Yep.
And we have a bunch of doctors of audiology now.
I know. It's like we're growing.
I know. Isn't it fun?
It is fun.
It's very exciting. So, but I do think we're unique that way in that we do have doctors of audiology.
Yes.
So you're going to get an expert opinion on your hearing. So today's show, I'm excited about pediatrics. I always have a ton of questions about new practices and approaches to how we help our little guys feel good and have a successful start in life. And today we have Dr. Lopez. He is with Little Buddies Pediatric Clinic. You can go to www.littlebuddiespediatrics.com or pediatric.com. And their number is 210-650-0814. Want to say hi?
Good morning, girls. How you doing?
We're
Glad
doing
to be
good.
here.
We're so happy that you're here.
Thank you very much.
Dawn's got your bio, your background. She's going to let everybody know what you did and how you
Okay.
got here.
Are you ready for this?
Yes.
Yeah,
Do you
buckle
remember
up.
what
This
you
is
did?
Your life.
I remember all my life.
Okay, so you're originally from Peru. You graduated from the National University Federico Villarreal School of Medicine in 1988. You did a pediatric residency in Lima. I have a question about that. Is it the
Yes.
same length residency as it would be in the U.S.?
Yes, it is 3
That's
years.
a good question.
It's 3 years residency. When I moved to the United States, I was in my third year. And then I moved here and did it again.
You had to start over.
Oh, no. But it just means you're, that much more experienced.
That's right. That means you have 6 years in a pediatric residency instead of 3.
Yeah.
So when you moved here from Lima, you went to New Jersey.
Yes. I did my pediatric training at Jersey City Medical Center in Jersey City, New Jersey.
Did you like New Jersey?
I like it.
That was
Besides
I like
the
it.
snow.
Yes, yes.
Besides the snow, it's a very, very nice place to live.
Yeah. How does
Yeah.
it compare to here?
Colder.
Yeah.
It's a lot colder in New Jersey.
It's a lot
Yeah.
colder.
And after you left New Jersey, you went to work at the United Medical Center in Eagle Pass. That's quite a change from
Yep.
New Jersey to Eagle Pass.
Yeah. Yeah, Eagle Pass, small town, 200 miles south of us by the border. And I spent there 10 years
10
working.
years. And then what brought you to San Antonio?
I had to make a change. And my kids were growing, needed a little more of daddy. So,
Yep.
yeah, work in rural areas is 24/7.
That's right.
So they didn't see my face sometimes for days. And they need their family.
Yeah. Yeah. It's important.
Yeah.
How many kids do you have?
I have 2 kids.
One is
Yeah.
sitting right here.
Yeah. My daughter, she is 27 and she works as an allergy specialist. And I have a son that is 26 that is studying dentistry in Boston.
Oh, that's awesome.
Yes.
So my daughter is leaving next week for Purdue. She's going to study aerospace engineering.
Wow.
It's hard to let them go, huh?
Yes, it's hard.
But it's healthy.
Yeah,
They got to
but-
leave the nest. You don't want them staying.
But you see them at the football games.
That's right. I'll see you when I fly up there to go shopping.
Yeah.
Dr. Lopez, what is the role of a pediatrician?
So pediatricians take care of children from the newborn all the way until 18 years of age. We focus very much in keeping the babies or the children healthy, growth, development, immunizations. We are able to determine if there's any problem early in life during the well-child checkups. And so if there's a need for any special treatment, we can plan for that. Okay. Also, we are trained in treating acute and chronic diseases. Mild to moderate. If there's something very complex, there's always pediatric subspecialties, like in any other branch of medicine. We have cardiologists, nephrologists, neurologists, and every specialty you can imagine, there is one for pediatrics.
Yeah, and I can remember when my kids were babies, it was frightening. If there was something going on and they were sick, running a high fever, you don't know how to handle it. So the pediatrician is a critical role and peace of mind for the parent, even if nothing's wrong.
Yes.
Because believe me, I was that parent. What are you doing here again? I think something's wrong.
Yeah.
So in your role of helping that parent raise a healthy child, how important are well checks?
Well-child checkups are very important. A lot of parents, they think it's only, okay, I'm going to bring my children for shots. And that's not the reason we go to a well-child checkup. We check growth. We see if the baby is gaining weight properly. We see if it's gaining length property, if the head is growing properly. But for me, the most important part is development. Development in children has 4 components. It's language, gross motor skills, fine motor skills, and social skills. So we evaluate all that.
So you said language, motor skills.
Fine motor and gross
Fine.
motor skills, as long as social skills.
Social. That's kind of important. People
That's very
people
important.
skip over that, don't they?
Yeah. So if, social skills, and that develops with time, is with age.
Right.
So
But there are benchmarks.
There
for
are
a 2-year-old.
benchmarks.
Are they co-playing? Are
Yeah,
they,
they are
sharing
doing- yes. Like-
in conversation?
like the very first thing we know is if the baby able to recognize their parents.
Oh,
Usually
yeah.
around 1-2 months, the baby sees mommy's face and he smiles.
Right.
Okay, so that tells us that they have good vision, and they have good social skills, and they start cooing, so they have good communication skills, and gross motor skills are usually a little later, like 4 or 5 months, when they start sitting, they start crawling, they start standing up, and things like that.
So when there's a delay with crawling, at what point do you start worrying? At what month?
Usually, for example, if they don't crawl by 10, 11 months, okay, usually an average baby start crawling between 7 and 8 months.
Right.
Okay, so usually what we see is at 6 months, can they sit and
Right.
hold sitting position for a few seconds? Because that's going to be very important from crawling. Okay, in general, for example, pediatricians, we discourage the use of walkers because that delays walking.
What?
Yep.
But
the
it
na-
allowed Mama to do her hair.
Yes. Yes, he's a 5-minute babysitter.
Yeah, that's right. It's
He's
a
a 5
5-minute babysitter.
He's
That's
a
right.
5-minute babysitter, but if you let the baby crawl, he will move and eventually get to the
Right.
sofa,
Right.
stand up, and walk.
Right.
Much
and,
faster.
And much faster. Usually
Yeah.
a baby that crawls by 9-10 months can be walking. A baby that gets in a walker, it takes about a year.
Oh, really?
So it delays because it's not the natural way. Yeah, we have to
makes
remember
sense.
that
That
walkers
makes
are an
sense.
invention of the last 60 years.
Right.
The previous 20,000, they didn't have walkers.
That's right.
That's a good point.
They would just strap him on the back. Say, we're
Yep.
going, work in the fields. Let's
Yeah.
go. You're going to pick while I pick. Okay, so if there is a delay, it's like a gross motor delay, is there physical therapy for children?
Yes, there is physical therapy, there's occupational therapy, there is speech therapy.
Yeah, hearing
And that's when we
therapy, if
use
there's a
your
hearing.
help because,
Yep.
especially for speech therapy, we have to know if the baby can hear.
Right.
And we send a
Yes.
lot of babies to do hearing tests.
Right.
Although they get it at the newborn screening, but that doesn't mean that later they get multiple ear infections or something
Right,
like that.
right.
They might lose
Have
that
a delay.
ability. Okay, so
Right.
and there are very good pediatric developmental doctors here in San Antonio that we refer sometimes,
Good.
so they can do a full developmental evaluation to see if there is any major problem, and do a whole approach to the baby, not just physical therapy, not just speech therapy, but everything that
So
they need.
what's the youngest you can send a baby to the developmental specialist?
Depending on the history of the child, sometimes they go from birth. For example, premature babies, they have very high risk of developmental delays.
Okay.
Okay, baby that is born term or near term, we evaluate, and sometimes by 4, 6, 8 months, we are sending it to the developmentalist if we see some signs of alarm.
So there's no age.
There's no age. Sometimes we send
yeah.
them at 2 years.
And keep in mind, if it's a premature baby, the actual age of development starts when that baby should have been born
Yes.
as well.
So
People
we,
forget
we,
that.
we
Yeah.
correct that.
Yeah.
So
It's like a correction factor.
That's what is called a corrected age.
Yeah.
Yeah.
Yeah. So what's the, before we go to a quick break, what's the average weight or healthy weight for a baby and length? Is there,
They are norms, they are growth charts.
uh-huh.
So, and we talk about percentiles. A percentile is not average, but it relates
percentage.
very, very much to an average. So depending on the age is how much the baby should grow. But there are patterns of growth also. Like a baby should grow about 2 pounds every month during the first 3 months. If they grow faster than that, it can be accelerated unless they are breastfeeding, because breastfeeding babies grow a lot faster than bottle feeding babies.
That was the problem. I had very healthy babies.
They are healthy babies. But breastfeeding babies, actually, they get to normal weight around 1 year of age.
Yeah.
Yeah, they are big, big babies. Sometimes I have seen babies 4 months, 20, 21 pounds.
Yeah.
There's
Wow.
the
Yeah.
weight of a 1 year old. But by 1 year old, they are 22 pounds.
It's a great
So
diet
they are
plan
normal.
for the mom.
Yeah, but
It does.
but
It takes
the payment at the end is worth, because that kid is going to be healthy.
healthy
Yeah.
with immunities from
Strong
the mother.
And very
Yep,
good, very,
nutrition.
very, very good relationship with mom.
Yeah, it works with bonding too,
Yeah,
right?
bonding is very important.
Yeah. Well, we're going to take a quick break. We'll be right back. You're listening to Ask the Experts of South Texas.
Do your loved ones say, "You're not listening"? Do they tell you the TV's too loud? Or do you have ringing in your ears or feel dizzy without explanation? Call Associates of Audiology. They are the experts at diagnosing and treating hearing loss and balance disorders for all ages. Call 210-334-0245 or see them at associatesofaudiology.com for a better quality of life. Don't let your ears keep you from hearing.
That's what the man said.
And we're back. You're listening to Ask the Experts of South Texas. I'm Dr. Davis.
And I'm Dr. Bledsoe.
And with us today is Dr. Lopez with Little Buddies Pediatric
Choked on
Clinic.
my water.
We have a doctor in the house.
I know, it's a good thing.
Yeah.
Dr. Lopez. He is with Little Buddies Pediatric Clinic. You can go to www.littlebuddieспediatric.com or call them 210-650-0814. It is pediatrics.com. It is plural. Oh, I just wrote it down wrong. So, Dr. Lopez, we were talking about like benchmarks for typical growth of infants, and even I would say, you know, for school age kids, there's benchmarks that they need to hit. For the part that you said for social skills, do you see a lot of kids that are just not socially, I want to say, acclimated or with the skill set to do that?
Yeah, the lifestyle we have now, daddy working, mommy working, everybody having such a fast life, we see that kids are not well stimulated. And what we do is we hook them to a cell phone or a tablet or the video games. And so we are seeing a lot of problems with babies having social skills problems. They don't know how to relate. They know how to use a tablet, they know how to send a text, but they don't know how to talk
Oh,
or
that's kind of
interact
frightening.
with.
My 3-year-old can like sign in to my Amazon, but doesn't know how to smile at me. That's
Yes,
a problem.
so it's a problem. So the family is very important.
Yeah.
Okay, parents should talk with their babies since they are little, so they learn social interaction. Kids, they have to play with their siblings, and now that's very difficult because again, everybody's hooked to technology, even the parents. Okay, and we see a lot of problems, and that leads later on in life to problems like violence, inattention, and health problems like obesity.
That's right.
And because they don't interact. It's sad to see that you go to a restaurant, 8 people in a table with 9 cell phones, because somebody
yeah.
has 2 cell phones, one watching their WhatsApp and the other one watching the Facebook.
Yeah, it's sad.
And nobody talks. So
So do you
that's
educate parents on that?
we try to educate, but they still do it.
Yeah.
It's very
it's
hard.
Easy. They think it's
easy because now
it's a shortcut.
cell phone is a very good babysitter, but it's not a healthy babysitter.
Yeah.
Yeah.
So I have a question about the social skills, because at some point it's obviously behavioral, environmental
Yes.
issues, but there are some kids where their social skills just really aren't there, and that's due to something else.
Yes.
Neurological or syndrome.
neurological or autism, psychological.
How do you
autism.
weed that out?
So normally we screen children for autism at 18 months and 2 years. That's 1.5.
Oh, really?
And
That
2 years.
early?
That's
Yes,
hey, that's
a-
good.
That's because that's when they start having fast development in language skills and
Yep.
social skills. That's when they start playing with their little brother or sister,
Or don't.
or they don't, okay, or they start talking and making phrases, and that's when parents can catch any abnormalities. Okay, although you can see some symptoms of autism, for example, in early infancy, like I was telling you before, if the 2-4-month-old looks at mommy and doesn't smile, then you have to open your eyes. What's wrong?
Right.
Can the baby see? If he can see, does the baby have any problem? I had a parent that she came and told me, I think my baby cannot see because when I have him in front of me, he doesn't smile. And actually, he had a neurological problem, a severe neurological problem. But other children, they have problems like autism. But we cannot test them formally until they are 18 months. That doesn't mean that they were not before. The same with language. They don't say mama, they don't say dada when they are 9, 10 months. They are just quiet and looking like a flat face.
Yeah.
Okay, and so parents have to
Something's
also
going on.
have to make the observation about that. So that's why it's important that they have that relationship. It's not just feeding the baby, change the diapers and put him to sleep, because there's a lot more than that for parenting.
So, while we're talking about autism, there's been a lot of information in the news about vaccines and autism.
I'd say there's a lot of disinformation too.
Well, yes.
Yeah.
Yeah, it's probably 100% misinformation. Yeah,
So vaccines do not cause autism.
Vaccines do not cause autism. AutismSpeaks.org, that is the largest advocate for autism treatment, therapies, and all that.
Autism.org?
Autism Speaks.
Autismspeaks.org.
Yeah, they recommend fully vaccinate your kids.
Oh,
Okay, good.
So if the people that work with autistic say they don't cause the vaccines don't cause autism,
There you go.
who are we going to believe? So this started like about 25 years ago in
Yeah.
England. Dr. Wakefield, he published an article saying that MMR is related to autism. That article
The
was
measles, mumps, rubella
yeah,
shot?
the MMR shot.
Yeah.
Okay, and he presented evidence, quote unquote, that there was damage because of that vaccine. But it was debunked along the years, and all the co-authors of that article withdraw their support, and even the publication withdraw the publication.
Yeah.
And so, but sadly,
So it was peer reviewed, and they said this
Yeah.
is not substantial.
Well, they couldn't reproduce the study. They
yeah.
couldn't
So
replicate it.
actually, at the end, he recognized that he forged all the investigation.
Oh,
my gosh.
And
well,
that's why
he caused a lot of problems.
he caused a lot of problems, and he's
from
in jail.
lying.
Wow.
Because a lot of children die because of his
Yeah, I believe it.
article. Yeah. So,
Well, that's why some of the
And there's a
the
lot of
diseases
people-
are back on the rise because
Yes.
people have stopped vaccinating.
yeah, they stop because, and sadly, when we hear the news, you put, vaccines cause autism. But when they put that, well, it's proven that they don't cause, they
Yeah.
just put it on the bottom line and
Yeah.
pass in 2 seconds and nobody could read it.
Yep.
Yeah, that's not.
Yeah, the
that's
good
not
news
good.
are never good news.
right.
Bad news are always good news.
You know what's something really awful? Polio.
Yeah,
Yeah. So I'd rather just go get my vaccination.
yeah.
So and not have a kid suffer.
I don't
through
know
that.
if I was lucky or unlucky. The last 2 cases of polio reported in all North, Central, and South America were back in Peru when I was doing my training, and they were my patients. They were
Really?
They were 2 unvaccinated kids.
Wow.
The response of the health department in Peru was to vaccinate every children, every doctor's visit. Doesn't matter what they go for a cold, they go for a
Wow.
child, they're vaccinated, and some kids, they get 10, 12, 15 polio vaccines. But the epidemic stopped at 2 cases.
Wow, that's pretty
And
good.
there has not been any more
that's
reports
great.
in the past 28
What happened
years.
with those 2 cases?
Polio kids, they survive, but they have neurological
Yeah, they
sequelae.
can't walk.
Yeah.
They can walk. Yeah, they get paralysis.
Mm-hmm.
But it's like that.
I've already learned a lot this half hour. It's
I
gone
know.
by quickly. We're going to take a short break, go to national news. We'll be right back. Dr. Lopez.
Thank you.
Doctor, my eyes have seen the years and the slow parade of fears without crying. Now I want to listen to what the flower people say.
And we are back. You're listening to Ask the Experts of South Texas. I'm Dr. Davis.
And I'm Dr. Bledsoe.
And with us today is Dr. Lopez with Little Buddies Pediatric Clinic. You can go to www.littlebuddiespediatrics.com and you can call 210-650-0814. You're in the Stone Oak area, right?
Yes, ma'am.
It's a great area to be. So
Yes.
we were talking about vaccinations right before the break.
Yes.
And go get them. Get them and get them for your children.
Yes.
I mean, it helps your immune system fight disease. But what about what's contained in the vaccination, like the mercury, aluminum, formaldehydes? Are those harmful to the body?
Mercury, formaldehydes are what are called are products that are used to prevent the vaccine to get contaminated. Mm-hmm. Mercury was used before in the, let's say, early stages of vaccines until the 1990s.
Oh,
as a preservative.
All the way up until the 90s?
Yes, and there
I was exposed.
So there was a controversy.
Okay.
You were exposed.
And we're okay.
I
Yeah.
don't know. That's debatable. Oh,
Yeah, there was a
debatable.
controversy because we were given the hepatitis B vaccine in the first day of life.
Yeah.
And what we were using at that time was what we call a multi-dose vial. So a little bottle that has 10 doses of vaccine. Mm-hmm. Since we had to pour 10 times the bottle to get the vaccines, we need some preservative so we avoid contamination.
Right.
And that preservative was thimerosal, that is a byproduct of mercury. Thimerosal is a very common disinfectant for wounds, and you can buy it over the counter actually. So it's not that dangerous.
So it's not going to hurt you.
Yeah, but
Good.
but of course there's always somebody that's going to find something wrong.
Okay.
So
Because they see that
after that, pharmaceutical companies, they start producing what is called single dose vaccines. So now what we use at the office is pre-filled syringes. That means one dose in one syringe. We give it to the child, and the syringe is discarded properly. Mm-hmm. So there's no need for those kind of preservatives. There's a little bit of formaldehyde, but the amount is minimal. That's not going to cause any damage.
It's probably more in Sweet and Low.
Yeah. Most likely.
Oh, my heavens.
Another thing is,
I know.
and
it's
probably
true.
one of the
I'm
latest,
preserving myself inside and out.
one of the latest complaint of people that see something wrong with vaccines is aluminum.
Yeah.
Aluminum is what is called an adjuvant. That means it makes the vaccine stronger for the immune reaction. If we don't put the aluminum, let's say the baby will produce antibodies like 10. If they have the aluminum, it's going to produce antibodies like 50 or 60. So what it does, it enhances the immune response of the body. Now, the amount of aluminum there is in vaccines is minimal.
So it doesn't hurt the thyroid.
It doesn't hurt. And a lot of people is afraid of getting Alzheimer or things like that.
Right, because there's a connection.
Yeah, there's a connection.
Saying.
Now, there's more aluminum in the air we breathe than there is in
And
vaccines.
in deodorant.
Yeah. So basically...
And I'm not quitting that, so just there we have it.
So the amount of aluminum they get with 1 year of vaccines is about what you breathe of aluminum in 1 month.
Okay.
So it's just like a trace.
It's a
barely.
trace. It's just an amount just...
So moral of the story, we need our air cleaned.
But there's no way to take the aluminum off the air.
Quit using aluminum pots.
Yet.
Oh, quit breathing.
Right. Do that too. No.
That's the answer. Quit breathing. I'm making light of
So
this,
you don't
but
get Alzheimer.
I'm doing preventative. Okay, anyway.
Yes.
Prophylactic treatment. I'm not going to breathe. Well, Dr. Lopez, so it can prevent disease. What about the new vaccinations that are out, like it's
HPV vaccine.
Yeah.
Is the next to last vaccine that came out for children. HPV vaccine is against human papillomavirus. It's given to both boys and girls starting
good.
at 11 years old. In high-risk areas like where there is high violence, rapes, and all that can be given as low as 9 years. And the new recommendations are for men until 26 and women until 40.
Wow.
So because at the beginning, the research was it prevents cancer. But now they have seen that people that has been infected, they still benefit from the vaccine.
Oh, good.
Decreasing the likelihood of recurrence.
Because they used to say that if you don't take it when you're young, it's not effective. But now
Yeah, so now the new research has shown that there's some effect in controlling people that is previously infected. So
I am over 40, thank you.
Okay.
just for this much.
Just for this much. Yeah.
So it helps preventing different kinds of cancer. Yeah. Originally, it was published as cervical cancer vaccine,
right.
But it can prevent genital cancer in males, and depending on some kind of behaviors, oral cancer, skin cancer, and also there are a lot of skin cancer that are related to HPV, that are non-UV related, and they can prevent that. Cancer, about 40% of those non-UV related cancers are
just
prevented.
learned another thing.
So it's a good vaccine.
That is good.
And one thing that is important, it doesn't contain the HPV. It's an engineered vaccine. So the only thing they do is they get a part of the virus that is what is called the antigenic part.
Right.
Is the one that produces antibodies. So there's no way you can get HPV infection from the HPV
Which
vaccine.
is with all vaccinations for the most part, right?
There are some vaccines that are now engineered.
Yeah.
Hepatitis B vaccine is engineered. Hepatitis A vaccine is engineered. The pertussis whooping cough part of the DTaP or DTP is engineered. So there's still some vaccines that they use the bug itself, like diphtheria, tetanus, MMR, chickenpox.
Yeah.
But other vaccines, they don't use that.
And you were also saying this before the show, that you can't double vaccinate certain viruses in a month.
Yeah, there are some restrictions in for patients that they want to scatter vaccines. So, for example, if you give a chickenpox vaccine, you cannot use another virus vaccine in a month.
Right.
Because it's not going to be as effective.
Is it okay to stagger the vaccinations with an infant, like wait till they've got a little bit more weight on them?
It's okay, but it's not recommended.
Okay.
Because normally we give like 3 vaccines at once. There's only one time that we give 4 vaccines is the 1-year-old vaccines. But normally there are 3 vaccines that we give to a child. And they are going to have pain, of course. But it's going to be one single pain in one single visit. If you bring the child 3 times in 3 weeks, they're going to have 3 pains. It's more suffering for the baby.
Will their bodies build better immunity, though, if you stagger them? Instead of doing all
that's
3 at the
what
same
I was
time?
thinking.
No, they don't. The baby is exposed to multiple viruses and bacteria during their life. You have to go grocery shopping and you're going to get exposed to a million things. What we give is about 6-7 vaccines at one time for the baby, like the DTaP, the rotavirus, the HIV, the pneumococcal, the hepatitis B. So we give them at one time. Actually, the immune system of the baby is so good that they can take 10 times, 100 times more than that, and they are not going to get sick. Their immune system is eager to for that. So
there's
a lot of people think, they are all going to overwhelm their immune system. That's not true.
See, that
it would overwhelm us, but not them.
Yeah. The moms and dads suffer more.
Yeah, that is true. Well, we don't want to hurt them. You know, we don't want to do something that's going to negatively impact them. So we try to be conservative in our approach. But in this case, get it done. You hurt them by waiting.
Yeah. And not only that, you hurt them because if they get exposed to a disease like whooping cough, can be prevented with 4 shots
Yeah.
along
Mumps
15
causes
months.
unilateral hearing loss,
And
single-sided hearing loss.
It can cause bilateral.
It can?
Yeah.
Yeah.
I have an aunt that had
And it can
lumps.
cause
Really?
sterility
Yeah.
in males.
That's true.
Yeah.
Yeah,
true.
and it can cause pancreas cancer because it attacks all the endocrine glands. But the thing is, whooping cough.
Yeah.
Whooping cough, you can be sick for 3-4
long
months.
time.
Oh, don't they also recommend if you have an infant in the house that the adults get the whooping cough?
Yes.
Yeah, and the Tdap
Yes.
vaccine is recommended.
Yep.
Now the indication is that moms for every pregnancy they get a Tdap vaccine. Dads, grandparents, they get it once. Yeah, usually dads are a little more chicken than mommies, so they get it only one.
Tell me about it. What's up with that?
Yeah,
Bend over.
yeah. Usually they cry more than girls.
Yeah, well.
Yeah, well. I was going to ask you about the meningitis one too, because my daughter's getting ready to get that one for college.
Yeah, so that's a requirement for college. Here in Texas, it's mandatory. You cannot go to college,
Right.
even if you're not going to a dorm. Just for going to community college, you have to have meningitis vaccine. We have 2 different kinds of meningitis vaccines. One is the regular, the MCV4, that contains 4 strains, and there's a separate one that's meningitis B. Although meningitis is very rare, we get 4, 5, 6 cases a year in the United States. You don't want to be one of them
I
because
saw one last year.
Should you
hurt her
get
hearing.
both the meningitis vaccines?
yes, because they are for different strains. And meningitis is a disease that is fast and don't give any warning signs.
Yeah.
And there's a viral and a bacterial, no?
Yeah, there's viral meningitis, there's parasite meningitis that usually are less aggressive.
Right.
Bacterial meningitis, the last case that was in Texas was at Texas A&M. Child that went to school at 8 o'clock in the morning and at 12 was dead.
Yeah. I
Oh
remember
my
that one.
gosh.
I remember.
Yeah, he's
Yeah.
got sick by 10, 11,
Yeah.
went to the ER. They couldn't save him because he's that fast.
Yeah.
Wow.
Yeah, you just get a fever, a sore throat, and 4 hours later
It's in your
you're
brain.
gone.
Get your meningitis shot.
You get it, and it's a very safe vaccine.
Yeah. I'm going to go get it.
I know. I'm like, I don't think I've ever
I
had
think
that
I've already
shot.
had it.
You
though.
can go back to college.
Well, you know, we're going to take a quick break. When we come back, I want to talk about another topic that's prevalent, especially in San Antonio, which is obesity, childhood obesity. We'll be right back. We've been talking with Dr. Lopez of Little Buddy's Pediatric Clinic. We'll be right back.
Only the echoes of my mind.
Do your loved ones say, "You're not listening"? Do they tell you the TV's too loud? Or do you have ringing in your ears or feel dizzy without explanation? Call Associates of Audiology. They are the experts at diagnosing and treating hearing loss and balance disorders for all ages. Call 210-334-0245 or see them at associatesofaudiology.com for a better quality of life. Don't let your ears keep you from hearing.
And we are back with the South Texas. I'm Dr. Davis.
And I'm Dr. Bledsoe.
With us today is Dr. Lopez of Little Buddy's Pediatric Clinic. You can call him at 210-650-0814. Go to littlebuddieспediatrics.com. So tell us, Dr. Lopez, about obesity. Is it more prevalent in kids now than it used to be? You hear all of the news, media.
We have a big problem with obesity nowadays.
In general.
In general, adults and children. And there's a lot of lifelong health complications regarding obesity. A lot of that has with the lifestyle we have. Okay? Busy
Sedentary.
life, sedentary. Parents, we go to the office, we're sitting there 8-9 hours in front of a computer, we barely move. We take a break from 12 to 1, we go to the fast food restaurant, And in Texas, everything is big, so we get a big meal.
Yes.
Since we are paying for it, we take it in.
You get a discount if you size up.
Yeah.
With the meal.
Yeah.
So,
and if you do it
and-
if you piecemeal some of the entrees, it's more expensive. I couldn't believe that.
Yes,
Makes
it
no
is.
sense.
So, and we go back to the office and again to sit down for the next 4 or 5 hours. Then we sit on the car, we drive home, we get tired, and we turn on the TV.
And our bodies did not evolve this way.
Yeah,
You
so,
know, thousands of years of evolution did not come to this
An
point.
average adult male has to consume about 2,500 calories.
Oh yeah.
An average adult woman, 2,500.
2,500.
But for women, is it 15?
Is about 2,000.
2,000?
What?
See,
Yes.
I can size up. I can go up to 500.
Yes. But that depends if we have a normal
Yeah, activity level.
activity routine. So we can burn those calories. But actually, we probably burn only 20%, 30% of that. And if you can tell me a male that takes 2,500 calories, when we get a 30-ounce soft drink, it's about 1,800 calories already.
Oh my gosh.
So,
Which is like when they hand you those, like this is like a 2-liter. What are you doing?
yes.
It looks like a 2-liter with ice.
You always finish it. You always finish the drink because you're paying for it.
Yeah, it's
So-
psychological.
So so we don't have that much activity, and at the same time, kids don't have much activity. What do? We give them the tablet. They are playing their PlayStation,
Yeah.
their Xbox or whatever, and they stay there, and that contributes to obesity. Now, so much processed food.
Yeah.
What I recommend my patients is drink water. We tell Daddy, don't buy soft drinks.
No soft drinks.
No soft drinks. And one of the most common
That's bad for their teeth too.
is bad for the teeth. One of the most common misconceptions is that thirst quenchers, Gatorade, Powerade, and all
Yeah.
of them are healthy.
Oh, they're high in sugar.
They are high in
Sodium,
sugar,
too.
high in sodium.
Yeah.
So I always remember that commercial of Dwayne Wade and LeBron James and Kobe Bryant playing and sweating green, sweating
Oh,
orange.
yes.
So I tell my patients, the day
and orange.
the day you sweat like that, you drink Gatorade. If you sweat water, you drink water.
Yeah.
Oh,
So-
yeah.
Yeah.
So there's no reason for them to drink thirst quenchers because it's too much sugar.
Yeah.
And actually, they get more dehydrated
Yeah,
because
it does the
of the
opposite.
sodium induced
Yep.
urination and the
Yep.
sugar induced urination. So they get more dehydrated
That's right.
and they drink more. So Coca-Cola company gets more money.
Yeah. God bless them.
Yes.
I don't want a phone call.
Yeah.
So, how much exercise is healthy for a child? Like when we say exercise, playing, it's just playing.
It's playing like 30, 45 minutes walk. Go and walk your dog.
Yeah.
Yes, take
Go
the
to the
dog around
playground.
the block, 30, 45 minutes, the dog is going to lose weight, you're going to lose weight. If you have the chance to walk to school, yeah, but here what we do is we have the school 3 blocks away and we drive them to school. They can block three blocks going to school, 3 blocks coming back, that's 6 blocks. It's a little bit of exercise. And actually, if the child does a little physical activity before school, he will have a better school performance.
Yeah, and he'll sleep at night too.
Yeah, they will sleep better. Okay, and risk factors for problems with health later on, like diabetes, sleep apnea, is very
Type
very
2
high.
is on the rise for children.
Yes.
Type 2 diabetes, which is like acquired.
Yeah, type 2 diabetes is a problem that 30, 40 years ago we saw in 50, 60, 70-year-old
Right.
people.
It's in children.
Now we have 7, 8 years old that they have that, or they have early signs of diabetes, like hyperinsulinism, high insulin levels.
Right.
And so that can be prevented with diet, exercise. What you inherit, you cannot change it.
Right. If
Okay,
it's, yes.
but
yes.
but you can change when are you going to get it, because
You can run from it a little bit.
yes.
Yeah.
For a few
So-
years.
For
yeah.
a few years. Yeah.
So if your grandma had diabetes and your mom had diabetes, do you really want to be diabetic? You
Right.
can delay it until your 60s or 70s instead of having to deal with a disease for 40, 50 years.
And you're putting them at risk for orthopedic issues, for kidney issues,
Kidney, heart issues, vision.
vision,
Yeah, diabetes
hearing.
Yeah.
Diabetes
it.
can cause blindness, can cause renal failure, and then you go to dialysis, and usually diabetics, they have very low, they don't get too high in the list of renal transplant, because if they don't take care of themselves,
Yeah.
they don't want to give them
Yeah.
renal transplant.
Right, because it's
So-
going to fail.
And orthopedic problems, vascular problems, they get
Right,
amputations.
vascular, yeah.
Amputations. So it's a life of misery if you get the diabetes.
Well, if you're just joining our show, we're talking with Dr. Lopez. He's with Little Buddies Pediatric Clinic. You can call 210-650-0814 and go to littlebuddieспediatrics.com. So tell us about food allergies in kids. Like how common do they outgrow them?
Food allergies are very common. The approach of food allergies has been changing with time. At the beginning, when I started practicing, the recommendation is try not to expose children to highly allergenic food, eggs, peanuts, tree nuts, fish. Try to avoid that until 1 or 2 years of age, because the kid is going to become allergic. Now
Is that true?
Now the research in the past 5 years, it has shown that that was not the right approach. Now we try to introduce that early in very small amounts.
Because I would do eggs and avocado.
Yeah. Now it's very common to do eggs and avocado, and the American Academy of Pediatrics recommends using small amounts, about 1 gram. It's about a pea-sized amount of peanut butter with baby meals, because they reduce a big time the peanut allergies.
Yeah.
What about honey?
Honey is sugar.
Is honey bad for babies, though?
No,
Because didn't they say...
it's a risk of botulism.
Botulism.
Yeah.
It's a risk for botulism, and that's not fun. But because high sugar foods can develop contamination with the bacteria botulism, and actually it's not that the food is bad, but it contains a toxin, because botulism is a toxin and can cause neurological problems.
What if you get it from a local farm?
I don't think that matters.
Doesn't matter.
Well, I'm just wondering how the bacteria gets in there, if it develops
It's
from
just-
it.
No, it's in the honey.
Okay.
Is what
that
it's
answers
called.
my
It's
question.
ubiquitous,
Darn
so
it.
it's everywhere.
Darn
So
it.
once you
I'm going to eat my botulism on my biscuit.
you open, an old-fashioned
I
treatment.
like honey on biscuits.
An old-fashioned treatment for constipation in baby was giving them water with
really?
honey, but there were causes of botulism in babies.
Oh, no.
Because the smallest bottle of honey is about 1 pint. You open it, and 2 weeks later, it has botulism.
Oh, I don't think I want to eat honey now.
Well, it won't hurt you.
I know, but it's just the idea. Now we're getting to another topic
on your wrinkles.
altogether. So can you do like allergy shots for babies now?
Allergies are very common in South Texas, San Antonio. We have a lot of allergies. Environmental allergies are very common. There are allergy shots for children and adults. In our office, we test children starting at 2 years of age for environmental allergies.
Doesn't your daughter test for that too?
Yes, it does.
Yeah.
And food allergies, in general, there are some skin tests that are available, and also blood tests. And we can determine if they have high risk for allergies.
Which one's more accurate, the skin test or the blood test?
They are different, but they can be both accurate.
Okay.
The blood test can be done as little as 6 months. And it's just a small blood sample. And we can do food and environmental allergies. Environmental allergies usually are done by region. So in Texas, we have a panel that we do. If you live in Northeast, it's another thing. Northwest is another thing, because environment is different. And they can get appropriate treatment. In families that are highly allergenic, probably we recommend to do a blood test before we introduce foods like peanuts or fish or eggs or something like
If
that.
someone in the family
Yeah, like the parents or one
is
sibling,
already.
or they have severe asthma, something like that, get tested or sent to the allergist to test and see, because the most important is not to do no harm. Okay, because if there's a strong family history of peanut allergy, that is allergic, has asthma, and we give peanuts to the baby and start having trouble breathing,
Oh, that'd be scary.
Yeah,
Can you
that was-
test for bees, like bee sting allergies?
there are tests. There are blood tests for bee sting allergies. There are tests for everything.
Wow.
You can test for everything. I recently got tested a kid that got his guacamole and got a rash, and he was allergic to avocado.
Oh, that's
Oh, wow.
so sad.
Yeah. So
My
there
daughter
there
has
are
a touch
tests.
of that.
There are tests for everything.
I have a daughter who's allergic to kiwi and pineapple.
Cammy is too, and apples.
Yeah.
Allison.
Yeah,
Yeah.
that makes sense.
Yeah, so-
Hi guys, right now they're doing a dance camp.
Right.
Have fun, girls.
But about 25%, 30% of children can outgrow their allergies, especially minor allergies like fish, milk, eggs. They can outgrow it. Boys are more likely to outgrow than girls.
Really?
Yes.
No
Why
fair.
is that?
Yes, that's something genetic.
That's just
Okay.
called life.
Okay.
Well,
But
Dr. Lopez, we're coming at the end of the hour. Thank you so much for being on our show.
thank you for inviting me.
You know what I've learned this hour? I've learned that you can get botulism as a kid in honey. I've learned that get your vaccinations. They're completely safe, and it's safer than the air you breathe, and it prevents debilitating disease.
And now that it's a back-to-school season, we have to
Yes.
use
Get
the
them
time
ready.
to get them ready, because we get a lot of patients that in the last day, the day before school, they come and they want to
gotta
blame
get
the
it.
doctor.
Yes.
It's your fault that my child cannot go to school.
Oh, goodness. Well, thank you, everyone, for listening to the show. Take care of yourself, because you know no one else will. And we'll see you back next week. Go see Dr. Lopez, 210-650-0814. Bye, y'all.